Good morning, everyone. I'm Lisa Clapper. I'm the Director of Student Care Network in our Student Care Coordination Office. And I have my colleague here, Dr. Jamie Hardy. Jamie, you want to introduce yourself?
Yes, good morning. My name is Dr. Jamie Hardy-Willay, and I am one of the Associate Directors for Student Care Coordination, one of the offices that Lisa oversees.
Great. So Jamie and I are really excited to be here with you today. And we feel our conversation is especially timely as your students are coming back from winter break, hopefully feeling rested and renewed to tackle another semester. And so what we're looking forward to sharing today is more about our Student Care Network and the multitude of resources that are available to support your student during the year, and also how you as a parent can help identify when some of those resources may be needed and really encourage your student to take advantage of them. So our Student Care Network is a holistic network of well-being and health resources available to all students who pay the student health fee. This includes undergraduate students and graduate and professional students. And really what we're looking at, we understand that well-being is not just mental and physical health. We're really recognizing these intersecting factors to include well-being, financial well-being, social well-being, sexual well-being. All of these impact our overall health. And so when we think of the Student Care Network, we're kind of thinking of this overarching umbrella that really encompasses all of the support resources, either on or off campus, that can support these areas of well-being. So we partner really closely with our counseling center. We partner really closely with our Center for Student Wellbeing, as well as other identity centers. So our Office of LGBTQI Life, our Black Cultural Center, Project Safe Center for the education and prevention of sexual assault and sexual misconduct, our housing offices, and all of our academic support centers around campus, so we can make sure we're addressing all of these intersecting needs. And our approach with the Student Care Network is really intended to help students explore and connect with resources based on their individual needs and where they're at. We really want to encourage students to expand their perspective of what is helpful. It may not always be therapy that's the most helpful thing. So we want them to really expand their lens on what they could be using, what skills they can be learning to help support them. So we always encourage students to visit our website at www.vanderbilt.edu/studentcarenetwork to learn more about the resources and kind of explore them so that they know where to go when the need arises. Most of our Student Care Network offices provide services in a number of different ways to serve students, so it may not always be an in-person appointment. It may be a satellite location around campus. It may be self-directed tools. We'll talk a little bit more about all of these things. As a parent, we also encourage you to visit the website and understand what's available. We also encourage you to follow us on Instagram, as we're often posting about different events that come up, different resources that might be available, or cancellations in the moment if we're not able to staff a particular event or a drop-in. So within the Student Care Network, I mentioned that it's sort of an umbrella that encompasses all of these offices, but there are 4 primary offices that comprise the network: Student Care Coordination and the Center for Student Wellbeing, University Counseling Center, and the Student Health Center. Now, I just want to touch quickly on the differences between some of these offices. Jamie will go into them with more detail, but our Student Care Coordination Office and our Center for Student Wellbeing are private offices, meaning that we try to keep as much as we can private between students and ourselves and what they're sharing with us. But we are mandatory reporters, which means that if your student comes to us with any information about sexual misconduct, that would include dating violence, stalking, harassment, sexual assault, anything like that, that would be something that we would need to report, as well as any imminent safety concerns, harm to self or others. The alternative is the University Counseling Center and the Student Health Center, where they have a more confidential approach to working with your student. So what they, that difference between private and confidential can mean the difference of a student feeling more safe, more accessible to share that information with one of our different offices.
So Student Care Coordination acts as the central and first point of contact that can support students through navigating the Student Care Network. This is a demonstration or a depiction of what it could look like to work with a student care coordinator. Because we have so many wellness resources available at Vanderbilt, student care coordination can help students navigate through what resource may be the best one to start with. However, students are not required to meet with us for most services. So we're happy to meet with them to be a consultation point as well. Another point in which we interact with students is if they're contemplating or coming back from or deciding to go on a medical leave of absence. We provide this as a support so that students have a touch point for transitioning in and outside of the Vanderbilt community so that they have support leaving or returning to the academic environment. When students meet with a care coordinator, it's important to understand that all resources are based on their individual and unique needs. So this could be connecting students with a university counseling center appointment, but therapy may not be the right resource. Some students are lacking skills that could be really helpful to their academic experience. And so we may connect them with the Center for Student Wellbeing or the Tutoring Center, for example. Importantly, care coordinators will always follow up with students so that they have the opportunity to not feel alone in navigating all of these resources and having a touch point to go back to if something isn't working or to report out if something was really helpful to them. In order to connect with student care coordination, students should visit our website, which is vanderbilt.edu/care coordination, and complete a brief initial assessment and schedule an appointment, which comes up directly after the assessment is completed. Students can also call us at 615-343-WELL, which is 615-343-9355. But hopefully that's easy for our students to remember. And we offer both in-person and virtual appointments. We also offer in-person and virtual drop-in opportunities to connect with a care coordinator, where students can do that in a more informal capacity Monday through Thursday at various locations around campus, as well as in our office, as well as virtually. And finally, typically staff have a background in mental health services, but it's important to understand that meeting with a care coordinator is not considered counseling or therapy. Another primary office of the Student Care Network is the Center for Student Wellbeing, which is an opportunity for students to connect with an office that can really help them build and maintain lifelong well-being practices. The CSW's primary activity is one-on-one coaching to help students set goals around healthy behaviors, offer strategies for achieving those goals, and maintaining accountability on the way to meeting their goals. Coaching goals may include stress management, time management, academic skills, relationship building, or behaviors related to the use of alcohol and other drugs. Undergraduate students may also meet with our peer guides. So peer guides are well-trained upperclassmen or upper division undergraduate students who offer well-being coaching. It's likely that those upper division students have experienced similar trials or tribulations or joys and successes as our students who are seeking support. And so we find that students really resonate with connecting with an upperclassman who can share some well-informed experience as well as tips and skills and strategies. In addition to coaching, the CSW offers skills-based workshops and ongoing well-being practices and works with student groups dedicated to promoting well-being on campus. This office also houses Vanderbilt recovery support. So this provides support for students who are either concerned about alcohol and other drug misuse or students who are actively in recovery from addiction. And for more information on any of the Center for Student Wellbeing's offerings, you can visit their website or follow them on Instagram. And students can also either email or connect via phone to schedule an appointment. Another primary office of the Student Care Network is our Student Health Center. So our Student Health Center is the primary place where students can receive care, primary care they are equipped to provide, as well as the opportunity to address acute health issues like the flu, or they also are equipped to provide support for students who experience chronic health concerns. Most students are on the student health insurance plan, but that is not required to be seen at the Student Health Center. All of those appointments are free of charge, so there's no appointment visit. However, there may be fees that are slightly associated with medications or supplies or labs. Those will be clearly explained to your students if they do encounter those types of needs at the Student Health Center. But we do try to keep those costs to a minimum. And to schedule an appointment with the Student Health Center, students can either call the Student Health Center at 615-322-2427, or they can download the My Health at Vanderbilt app or set up the My Health at Vanderbilt portal on a browser. And that can provide opportunities to not only schedule an appointment, but also see immunization records, see lab results, and communicate with their providers directly. The final primary office of our umbrella, the Student Care Network, is the University Counseling Center. So the University Counseling Center is our primary on-campus mental health service, and it's an integral part to what we do as a network. The UCC strives to facilitate emotional well-being and academic successes of Vanderbilt students by providing short-term mental health services that are flexibly optimized to meet students' needs and goals in a safe, affirming, and inclusive environment. They offer a variety of services, including group therapy, individual therapy, also medication management. There's also daytime and after hours crisis support, and there are also outreach opportunities where University Counseling Center staff get out into the Vanderbilt community and make themselves and their services known or more known to students. The UCC does offer assessments and screenings for ADHD and other learning differences, but there can sometimes be a wait for these services. In the circumstances where a student needs to connect more quickly with an assessment or a screening for a learning difference, we encourage students to connect with student care coordination so that we can talk about an off-campus provider. We have many connections with our Nashville network where we can provide more information on the cost associated with an off-campus assessment, as well as how students can provide or can gain transportation to those off-campus places. In full transparency, there can be a wait for scheduled appointments as well. And unfortunately, that is the reality of the mental health landscape across our country. But with that being said, the University Counseling Center ensures that students have convenient access to our counselors by offering regular drop-in consultation. So this is another informal opportunity for students to get in front of a therapist and talk about the challenges or questions that they're experiencing. It's helpful to note that the University Counseling Center has also established some identity-based drop-in sessions. So this is an opportunity for students who may identify as Black or LGBTQIA+, or as an international student to receive support in an informal way, also in an overtly affirming space as well. Additionally, students can drop in physically to the urgent care counseling opportunities that we offer Monday through Friday, 10 a.m. to 4 p.m. And again, students can connect 24/7 by calling the University Counseling Center, and that number is 615-322-2571. So I mentioned a few offices like student care coordination and then also the University Counseling Center specifically with drop-in. In reality, all of the offices within the Student Care Network offer drop-in services. So we recognize that accessibility and the opportunity to connect in the right place, or in the right space at the right time is really important to our students. And we're committed to offering opportunities for students to connect in the ways and spaces where they feel most comfortable. So this means that our University Counseling Center therapists, our care coordinators, and our coaches are outside of our offices on campus many days a week, where we have opportunities to sit in our cultural centers or our identity centers, or in some of our academic spaces where students may attend classes or connect with their social groups or their student organizations more frequently. And again, it is in several of these places where they're offered identity-based drop-ins so that students can receive overtly affirming support in spaces where they may feel most comfortable. And the calendar that provides live updates where students can find drop-in locations and also how to get connected is available on our Student Care Network website.
Thanks, Jamie. So in addition to the brick and mortar offices that Jamie's explained in the scheduled appointments, we do offer a number of self-directed tools. And really this is intended to help students take an active approach to their well-being, to use in conjunction with some of these appointments they might be having, or it can be really helpful for a student who may not be ready to take the leap in doing an appointment, or maybe who wants to just sort of take that journey on their own to explore well-being resources. And so Vanderbilt offers students free access to Headspace. If you're familiar with that, it's a digital app dedicated to mindful living. It includes guided meditation, some really helpful sleep content, mindful movement exercises, all focused on reducing stress and increasing resiliency. Students also have access to guided meditation tracks at the UCC. They can scan the QR code and look at all of the self-directed tools, but also find those guided meditations there. All of our students have access to academic live care. And there's actually a question in the chat, so I was going to save it for this. Academic live care offers free telehealth appointments for students for both medical and mental health care, as well as nutrition services. So this is available for all students who pay the student health fee. They can connect virtually with either a primary care doctor about a medical issue, or a therapist or a psychiatrist or psychiatry nurse practitioner for medication management. And those are all free of charge. Students that have access to our student health insurance plan have access to MindCheck, which is kind of a mental health platform through Aetna that uses some simple color coding to assign your mood a color, and then talks through different helpful tips on how to cope with that particular mood. And then finally, we have the Student Care Network partners with WellTrack Connect. And WellTrack Connect is an online database where students can find therapy providers off campus. As Jamie mentioned, sometimes the University Counseling Center isn't the best fit and students need to go off campus. If they're open and would like to do that on their own, WellTrack Connect can be a really helpful way to find those resources. They can search by identity, by insurance, and things like that. Or they're also welcome to come to student care coordination, and we're happy to help them connect as well. So that's kind of the service overview about what we offer. And I think it can be helpful to talk a little bit about common experiences. You may have already experienced some of these things. You may have yet to experience them, but hopefully it's helpful to understand that these are in fact common and expected, and that there are resources within the Student Care Network to really support your student with these challenges. Your student has changed and formed new relationships since being away from college, and so have their friends from high school. So, you may have noticed over the winter break, maybe some strain in relationships, maybe feeling like they don't belong with their crowd at home anymore, or even similar feelings with family as they establish more independence and are coming into their own identity. So when we think of resources and support, student care coordination, our peer guides at the CSW that Jamie mentioned, all of our identity centers, like the LGBTQI Life Office, our Black Cultural Center, our Office for Spiritual and Religious Life. These can all help support building community and processing some of these changes as they grow into themselves. Similarly, the relationships even at Vanderbilt may change throughout their time here. So some students will join a Greek organization, others will study abroad, and there's often grief felt when a friendship is lost. And so this is real and powerful, and we don't ever want to discourage this. So, encouraging your student to reach out if they're grieving a loss or feeling lonely. Our University Counseling Center offers wonderful support around this, as well as our Office for Spiritual and Religious Life. They actually offer a support group called GriefNet to support students experiencing grief from every type of issue. So it could be a death in the family, it could be a loss of a friendship, it could be a loss of, other parts of their identity. They don't discriminate against type of grief or what that issue is. It's very common, especially for first-year students, as they transition to the university level work, that you may see a change in grades. Could be perhaps not what they anticipated or you as a parent initially expected. And when we see those kinds of concerns, that's really when we're going to try to focus on academic coaching. Coaching at the CSW, other workshops at the CSW that focus on study skills, organizational skills, prioritization can be incredibly beneficial during this transition. I recall a pre-submitted question was also around STEM support. For students in the STEM fields. Our College of Engineering has their own tutoring and their own workshops that they provide, as well as some additional coaching through the School of Engineering. So those can be really helpful, specifically for those students in those major programs. It's also beneficial to notice that sometimes academic changes are signaling behavioral changes or emotional changes. It might not always be the first indicator, but a lot of students may experience changes in their grades due to depression or anxiety, sometimes even following a traumatic event or a concussion. And so these are, of course, very concerning. It's helpful to address them as soon as possible to provide adequate support. And sometimes that can be through some of these skills-based types of things. Sometimes it may be through therapy. And other times it may even be necessary to take a temporary leave of absence. And as Jamie mentioned, student care coordination can really help students understand what those options are and what may be the best path. Your student, and even you, may have started the college career set on a particular path of study or a career goal. It's common, super common, even expected for this to change and for it to be unclear for a bit. Again, this is an area where conversation is really key, and there are many resources to help with that. Our coaches at the Center for Student Wellbeing can help students define different personal goals. Our Career Center are experts at this. They have lots of different personality tests, batteries, things like that to really dig into what your students' interests are and what career path may align with it. And additionally, just talking with their academic advisor, talking with their program directors, or even some of the academic deans, kind of understand what they're looking for and then map a path towards success academically towards a particular major can be really helpful. Finally, we see a lot of students who approach their college experience, approach their college experience thinking it will be a new me because they're in a new environment. And while they'll definitely try new things, we do find that students sometimes struggle even more. Coming to school, they lack structure, they might be used to living at home, and this can really create unexpected challenges and even more stressors. And so some students come to college thinking, I'm not going to continue seeing my therapist that I saw. I'm not going to continue taking the medication I was taking. Or often, I had academic accommodations in high school, but I'm going to try college without them. And this can be tricky. We want them to explore and be independent and try these new things, but oftentimes these supports are even more important in college. And we received a pre-submitted question asking if we could give one piece of advice to incoming students, what would that be? And this is probably mine. Definitely want to encourage your student to explore new things and move out of their comfort zones, but try not to discard those helpful supports that were helpful for them in high school or before coming to Vanderbilt, and that can keep them grounded and are often necessary now. And then I want to talk a little bit about, as a parent, how you can help support, nurture support and support these help-seeking behaviors. So the first Student Care Network saw roughly 25% of the Vanderbilt student population in the last academic year. We had almost a little bit over 23,000 appointments across the primary offices. So not only does this demonstrate the need for services on campus, but that it's really normal for students to seek support. Again, we had a pre-submitted question around the increase of support services, and this is evident nationwide. We could have an entire webinar around the reasons that are contributing to this increase in utilization, but the one notable reason is that there's a lot less stigma around mental health awareness. There's a lot less stigma around help-seeking behaviors, and that's a good thing. We want students to reach out for help. And so that's really why we're seeing an increase in support. And so being able to normalize that for your student can be really helpful. Of course, seeking support early before a crisis ever occurs. We find that students, when they're in that crisis, they don't know where to go, and the tendency is to freeze. So being able to explore resources ahead of time to understand what is available when that need arises is really helpful. Starting small, we don't expect them to come in and make appointments with all of our offices, but even checking things out like Headspace, meeting with a peer guide, starting with some of those, or starting even with an introductory meeting with the student care coordination, just to kind of, again, understand where to go if they need it, can be really helpful. Helping challenge resistance. We encounter resistance all the time. One way that we really help students understand is when kind of identifying when they might be contradicting themselves or when they might be contradicting their own actions or beliefs. So for example, we see students that come in and they say, I've had so much trouble sleeping, but I've tried everything, nothing's working. So then we explore that with them. Have you tried talking to a coach about sleep hygiene? Have you tried Headspace and the sleep content there? Kind of identifying those areas that maybe they haven't tried. Gently, of course, but being able to identify sometimes where those discrepancies are can be helpful to nudge them into the right direction. Jamie mentioned our wait times. They are inevitable, but it can also be helpful for you to normalize that with your students. So sharing that you also have wait times to go see your primary doctor or your therapist or whoever that might be. And yes, while we do have wait times, we also have a number of avenues that allow students almost instantaneous access to care coordinators, coaches, and counselors. So reminding them when you might be hearing about them saying it's too long, they can use any of the drop-ins, the workshops, things like that, to talk with someone more immediately. It can be really helpful to talk to your students about insurance and the importance of managing their medications. We talk to a lot of students who have no idea what a deductible is, what a copay is, how to make a doctor's appointment. So prepping your student for all of this is really helpful just as they continue to grow into successful adults. We also have our SHIP email address, ship@vanderbilt.edu. So if you ever have any questions about the student health insurance plan, please direct questions to them. They can get back to you with more information about the plan, maybe why they were charged for something when you didn't think that they would be. Our partners with student health or the student health insurance plan are great. And then finally, as a parent, it can be really helpful to understand privacy and confidentiality of our offices. So I mentioned earlier, we have some offices that are private, some are confidential. All of our offices are bound by FERPA, which is the Family Educational Rights and Privacy Act. And this basically means that without your student's explicit permission, we cannot provide information about their academic record, including whether or not they may be meeting with one of our Student Care Network offices. And I know that this can be frustrating for parents, especially when you are the ones often paying the tuition bills. And I hope you know it's not intended to create a barrier for you or to complicate things, but it's really an effort to protect your students' privacy and to encourage them to seek assistance, knowing that this information can stay private and they can continue to seek that independence if they need that. If a parent would like to share information with us, we are always happy to receive that. Parents can give our office a call. We also have a student of concern report that I will mention, talk more about. But parents can always give us a call and either share just relevant information that they might have, or if they're concerned about their student, we will take that information and we can always translate that into an outreach to your student to see how we might be able to connect with them and help. Our student of concern report can be really helpful. It's basically an online form that you can reach from our Student Care Network website, or you can just Google Student of Concern Report at Vanderbilt. And it's an online form that just shares concerns about any of our students. We get these a lot from faculty, from RAs in the residence hall, from other friends, students, peers, sharing different concerns that might be coming up. And then depending on what those concerns are, my office takes that information and then we decide what the best way might be to reach out to that student. We do respond to every student of concern report, either directly reaching out to students or coordinating outreach by somebody else within our network, as well as we're always letting you know that we've received that report and that we are following up on it. Again, we may not be able to provide specific information about what that follow-up looks like, but please know we are taking those steps to connect with your student. So to wrap everything up, we get a lot of feedback that these presentations are helpful, but that it's so much information. So where does my student actually start? And we'll go back to really that hub of the Student Care Network, which is student care coordination. Our job is really to know about all the resources on campus and talk to your student about what's going on and how they can navigate that. So, talking about options. Well, you could go here for this, you could go here for this. What steps do you want to take next? And then really kind of helping them figure out a plan to take action. So that moves us into some questions. We've got some time for questions, which I'm really happy about. I know some of them were answered in the chat. And then there were some pre-submitted questions that we'll go through. And then Jamie, was there anything that we didn't answer written that would be helpful to address for the group?
Everything was answered. I do want to reiterate that if there is a question that students have, then they don't know where to start, or if they are needing any support in drafting emails to faculty about maybe having to miss class due to an illness, student care coordination can be a great place, especially drop-in for those kinds of reasons, where if students just need some in-the-moment help drafting emails to faculty or just figuring out a plan of what to do next, either for a situation that just arises or something that's been going on for a little while. Just want to reiterate that student care coordination is a great opportunity for students to get connected to some support, even if you haven't heard that issue mentioned in our presentation. We can oftentimes help find answers that maybe students couldn't find otherwise.
Great. Thank you. And there was a question in the chat that I think is helpful to address verbally also. It was about students who might miss a week of class and what support there is available. And so Jamie answered in the chat, we definitely expect all of our students to have that conversation with their professors. If they're missing one class, two classes, that's a conversation that they should be having as responsible adults to talk through what that looks like, what the plan is to make up work, etc. For longer term health concerns, missing a week of class, for example, we do have what's called a dean's notification. All of this information can be found in the student handbook, but basically a dean's notification may be appropriate for a student who has an ongoing medical concern that is causing them to miss class, multiple classes, within a span of maybe less than 2 weeks, more than a couple of days. That could be relevant for a death in the family. It could be relevant for an illness, some other traumatic event. Students can come to student care coordination and talk to us about what that looks like. A dean's notification is basically a request to your students' faculty members to say, we understand that something is going on with so-and-so. We would request that you work with them and If there's flexibility to provide, please provide that flexibility. It's only a request. It's not a guarantee that there will be any flexibility, that there can be any flexibility, but it's basically reiterating to that faculty member to say, there is something going on with this student. We're aware of it. We're providing support. And can we offer any academic flexibility in this sense? It's always up to the professor's discretion whether there can be any flexibility. And again, it requires that communication between your student and their instructor so that they know what the plan should be. They can know what steps to take, what extended deadlines there are, etc. With that, I'm going to go through some of the pre-submitted questions that we had gotten prior to the webinar, and then there's some really good questions in the chat too. In terms of explaining support when students get very sick, it is a challenge. We have a residential community that, students live and work within our campus community. They are, responsible for going to get their own meals and things like that. Now, there are some programs through dining that students can order meals via the Get app and have a friend go and pick them up, or sometimes their RAs can go and do that. But generally, we would anticipate that students would be able to find an alternative, someone else to go pick up meals for them. Additionally, there's a question in the Q&A: if a student is very sick, will someone inform their parents? That's a great question. Again, we protect students' privacy. So when a student is sick, we may be following up with them and asking them, have you talked to your parents about this? Have you notified them what is going on? We would really hope and expect that that communication would come from them. That being said, there is an exception to FERPA that if there is a serious illness, a serious emergency, a student is hospitalized, we can get in contact with parents and share that information. This is also in our student handbook. If a student is hospitalized, whether that's for a medical or a mental health emergency, our office is often connecting with parents to let them know about that. And again, if parents have a concern, who do they contact? You can submit a student of concern report, or you can call our student care coordination office, and any of our care coordinators would be happy to take information if you are concerned about your student. Let's see. There was a question about student organizations. It sounds like someone's student was having a hard time figuring out which ones to connect with. And would there be a person that they could talk with? Your students can actually go directly to our Office of Student Organization, Leadership, and Service, and they can meet with someone within that office to kind of understand how to explore AnchorLink, which is the database that houses all of our student organization information, kind of talk through what they can search for based on their own interests. So they can actually just go into that office. Again, it's Student Organization, Leadership, and Service to talk to someone there. And we talked a little bit about hospitalizations. Again, support upon returning for a student who might be in the hospital. We always encourage, if it's a medical hospitalization, we always encourage students to connect with student health. Even if that's not their primary doctor, it can be really helpful to have that connection on campus. For any medical follow-up, any medical questions, things like that, just to be able to have that touch point. I spoke about a dean's notification. If we are notified that a student is in the hospital, we can absolutely send out a dean's notification request for that. And the other piece of support that I would really recommend are accommodations through Student Access. Student Access is our office that manages all academic and housing accommodations for any disability or limitation as it might relate to a diagnosis. And so being able to connect early with that office to have those accommodations in place can be really helpful. I'm looking in the chat now just to kind of see some of the other questions. There's a question about the housing selection process for rising sophomores. I'm going to have to punch that question to our housing office. That would not be within the purview of the Student Care Network. And so I would really recommend reaching out to Jamie. You might have to help me. Is it o'hare@vanderbilt.edu?
I will verify that right now, just to make sure they didn't. The office changed names a bit. And so we want to make sure that their email address is still aligned with that.
Thank you. We also got a pre-submitted question about like early warning systems. How do we get notified early on when a student might be in distress? And so a couple of ways. Again, I mentioned our student of concern report. It's a great way for faculty, for students' peers, for other folks in our community to share those concerns. So if if faculty is noticing a student is missing class, in an ongoing manner, maybe they've shared some concerns directly with that professor. Maybe there's some concerns in written work. Our faculty are very good about sending that information to us, and we sort of use it as a puzzle piece to kind of put the story together around what might be going on. We also get notified about midterm deficiencies. So if students, that would be our sort of our mid-year point of the semester. Academically, if they're getting midterm deficiencies, that would be either excessive absences or failing a class. We get that information so that we can connect that academic concern with a potential emotional or behavioral concern. So we're often reaching out to those students to say, it sounds like you're struggling academically. What else might be going on? How can we support you? And then we have a really good collaboration with our academic partners. So again, if we're not getting a student of concern report, but if maybe the academic deans are hearing from professors, they're often in communication with us so that we can understand what that looks like and be able to reach out and follow up.
And to circle back on housing, that was answered in the chat, but their email is housing@vanderbilt.edu. Their phone number is also available on their website. That's 615-322-2591.
Thank you, Jamie. So I think we have about 2 minutes left. I'm not seeing any other questions in the chat. So with that, I just want to thank everyone for being here. I know that the slides and the recording will be out, and that will be sent to everybody, but I really appreciate your time and just your interest in this particular piece of Vanderbilt, and we're happy to answer any questions if you would like to reach out to either one of us. It was lovely to have you all here today. Thank you so much.